Well, welcome everyone. It is noon, so I am going to get started with today's All In for Kansas Kids bi-weekly webinar. It is April 7th, 2021. I am Debbie Deere, and I'm the Early Childhood Systems Coordinator with the Kansas Children's Cabinet. And I am joined by a team of people who are going to provide a lot of information to you today that I hope that you can take away, and it will be helpful in your work. Today's agenda is very simple. We have our regular general updates, which I will share with you. And then we have a group here from Child Care Aware of Kansas that is going to be presenting information about the Child Care Health Consultant Network. I wanted to let you know that April is Child Abuse Prevention Month. For some of you that may not already know that. And since 1983, April has been recognized as the National Child Abuse Prevention Month. And this month, as well as throughout the year, we all work in early childhood to raise awareness and increase support for children and families. And if you are interested, the Kansas Children's Service League offers pinwheels for purchase. And if you can see, I have one on here. It's a pinwheel pin, or they also have these blue pinwheels that are a symbol of Child Abuse Prevention Month. And so you can also plant a pinwheel virtually if you go to the link that's provided here and put a personal message or a dedication, with your pinwheel. So if you're interested in doing that. Can we move? Okay, thank you. Sorry. The Family Service and Guidance Center is providing a parenting class called A Parent Survival Guide, the Preschool Years. And speaking from experience as a parent of preschoolers many years ago, this type of a class would be very helpful, I think. It's a real world parenting series for parents and caregivers, and it's on April 15th in the evening from 6:30 to 7:30, and registration is free, but it's also first come, first serve. So you'll want to get your spot reserved very soon at the link that's provided here. There is rental assistance going on to households that have missed at least one rent payment as a result of the COVID pandemic. Up to $5,000 is available for rental assistance. Again, those funds are limited and it's on a first come, first served basis. So you can go to this link here to apply for this assistance if you or someone you know might need it. Some of you might have participated in the Our Tomorrow's Rural Sense Making session on March 25th. Over 60 individuals attended, including childcare providers, home visiting, economic development, breastfeeding coalitions, and others. And 27 Action Lab applications were submitted as a result. And the KU Center for Public Partnerships and Research are reviewing those applications. And we always welcome you to share your stories and experiences on the Our Tomorrow's website, which you can find the link here. So now we are ready to move on to our program. As I mentioned, it is from Child Care Aware of Kansas, and the Child Care Health Consultant Network is what they're going to be presenting on. I have Sarah Mitchell here with me, and she is going to introduce us to the rest of her team. Welcome.
Thank you, Debbie. We are so excited to be here. I'm going to go ahead and share our presentation. So our screens are going to switch. There we go. All right. So we are thrilled to be here today to discuss the Child Care Health Consultant Network with you all. Thank you for the opportunity and the time. We see some familiar faces, and we also see some new friendly faces. So we're excited to get the word out about the work that we are doing. and explore some of the opportunities along with you and answer some questions. So feel free to type some questions in the chat and we will come back to them as time permits. So first, we're going to dive in a little bit about what the network is, and then the team will get an opportunity to introduce themselves to you all. So we wanted to really get a chance to just share with you that the Child Care Health Consultant Network is supported by the Kansas Department of Health and Environment with funding from Kansas Department for Children and Families. So this project has been funded through coronavirus relief funds, federal funds, and some Economic Security Act, CARES Act funding as well. We are really working to establish goal setting and consultations regarding COVID-19 mitigation, health, safety, and wellness. And this is something that is available to all licensed Kansas child care providers. So we are thrilled to be able to offer supports and services to every licensed provider out there in the state of Kansas. And we encourage you to tell your friends and neighbors about this, as we would love to get in contact and support programs, not only through COVID-19, but through some health, safety, and wellness needs as well. We can support COVID-19 and we are happy to do so, as we know it is still very much part of our world and very much part of the early childhood setting. And we want you to know that we are here to support you as providers through this time. So when are consultations available? Right now, we are starting to offer new consultations to providers who are new to the network and have not yet had the opportunity to experience Child Care Health Consultant Network. We also are continuing services for programs who worked with us in 2020. So those programs are getting continued consultations regarding specific questions about health, safety, wellness, and COVID-19 mitigation. And as we're speaking, we are receiving consultation requests. So please don't hesitate to reach out. Where? So currently, we are holding all of our consultations virtually. Zoom, by phone. We work with the provider to identify what works best for you, and then would really like to execute consultations that way. We are hoping eventually to be in person and be able to do some of those on-site visits with you as the provider, walking your space, taking a look at your playground. Environmental needs are very much at the heart of what we do as well. And we are looking forward to when COVID protocols allow to being in person. So why are we rolling out this network? Well, as the state of Kansas, we have not had the opportunity yet to have a health consultant network for early childhood education. So the child care health consultants and the child care staff, they work together to promote healthy and safe environments for young children. The CCHCs, the consultants, have expert information, resources, and referrals to offer. So if you come to your CCHC with a question and they don't know immediately that answer, they know how to find the answer and can connect you with the people who maybe have the appropriate resources for your needs at that time. So now we're going to take an opportunity to meet the team. And the ladies are going to go ahead and unmute themselves and just give a brief introduction. And we are missing a few folks, so I will chime in for those individuals who are not here today. But we'll kick off with Bridget.
Hello, everybody. I am Bridget Banks. I am in the Northeast region, working remotely out of Topeka, Kansas. And it's a pleasure to be able to serve the Northeast region. I look forward to talking with you all.
Hello, my name is Rachel Fisher, and I'm also in the Northeast region and also stationed in Topeka, Kansas.
Thank you, Rachel. And we do have a new hire that is onboarding this week, so they are not available right now for the meeting, but they will be our North Central consultant. So we're very excited about that region being filled. And we have two South Central consultants, Dean and Heather Kosar, who are available in the South Central region to help you with any of your healthcare needs you may have, and they also support a wide variety of provider services. And we also have Rebecca Meyer, who has onboarded recently in the Northwest region and will be full-time with us starting this summer.
Hi everyone, my name is Jessica Soto Botello and I am in the Southwest region. I am remotely from Garden City, Kansas, and I am looking forward to meeting you all.
Hello, everyone. My name is Luisa Alvarado. I am also in Southwest Kansas, here in Garden City, Kansas, and I'm the Network Office Support Specialist. Glad to be here.
Great, thank you, ladies. So as you can tell, we are working to fill our regions with experts within the community, because a large part of what we do for Child Care Health Consultant Network is resource and referral. And so we really want consultants right there in your communities to be able to help work with you and identify any needs and then potential resources and offerings you have right there available to you. So here's a visual of our regions that we serve and the way that our consultants are divided at this time. So we use the KDHE Public Health Region map for reference, and we're split up into 6 regions: Northeast, Southeast, North Central, South Central, Northwest, and Southwest. So Louisa is not added to this map because she covers the whole state with her responsibilities. So she is an expert in all of the needs for network office support specialists. And then the rest of our team, as you can tell, has their specific regions that they get to work with the providers within those counties.
Now that we have put a face into each region, who are health consultants? We are professionals trained to work directly with childcare providers in centers and homes by providing consultation services, community resources, information, and referrals. Below you'll find a list of competencies that we'll be talking about in a further slide. Next slide, please. The consultants utilize and reinforce the existing strengths of those who are coached. This model of strengths-based coaching is founded on mutual respect and trust, with the end goal of empowerment for action by the director/provider. Strength-based coaching validates and respects the individual's experience and strengths as a foundation for future growth and learning. Next slide, please. What should childcare providers expect? Consultants will support and encourage providers in meeting health, safety, and wellness goals for their programs. They will work together to solve problems related to health, safety, and wellness, and seek solutions that support best practices in early learning. Next slide.
Great. Thank you, Jessica. Wonderful. So as you can see here, we have a visual for our provider experience pathway. This gives an idea for providers as far as what to expect and what is coming next when you are working with a child care health consultant. As you can tell, we have 2 different buckets of providers listed here. We have phase 1 providers and phase 2 providers. Phase 1 providers are providers that have worked with us in 2020 or maybe have been referred through KDHE or another entity. We are recognizing phase 2 providers as those that are coming on in 2021 and are new to our services. So both buckets of providers will work to ensure that they are requesting a consultation and reaching out, because this is on an as-needed basis and it is on a provider requested basis. So once you let us know at Child Care Aware of Kansas that you would like to receive consultation, we then process those requests and work to assign providers to consultants. Once those providers and consultants are assigned together and make that contact. We then work to collaborate to complete goals and a consultation plan. So if you're a new provider and you're in phase 2, you may do a little bit more information on an intake form or an agreement form, things like that. If you've worked with us previously in 2020, you may go ahead and start right into some of that goal setting with your consultant. We really look to identify goals alongside with you as the provider. You are the expert in your program. You know what your program needs, and we want to make sure to honor that every step of the way. So providers work alongside with the consultants. They complete a consultation plan that determines goals, needs, and coaching frequency, and the mode of coaching as well, so that everyone is clear as far as expectations and what is going to come next. Providers and consultants work closely side by side during this goal setting plan to ensure that there are resources being shared, that there are brainstorming opportunities, and that the consultant can again serve as a support to that provider. If you are implementing new policies or practices, if you are identifying new resources for your program, that consultant will follow up with you, check on that goal setting tool with you, ask how's it going? What can we do to help? And we will continue to track that progress. As we track that progress and work together, we will then review the goal setting tool once that goal has been met, or if we're looking to maybe extend the time frame of the goal. So maybe we need to identify what barriers are in the way and what time frame we need to readjust for the provider to ensure a successful completion of the goal. After that step, we really take an opportunity to look at the additional topics and competencies that are available through Child Care Health Consultant Network to identify if there are any other topics or any other needs that you as the provider would like to focus on and work on moving forward. So this can be a cyclical process. It can be something that once you complete a goal as a provider, you may determine that you would like to work on a new goal. You may determine that maybe you'd like a little bit of time between goals. Maybe life has gotten a little bit busy and you can always come back. So we are here to support you and your needs and really working to identify how we can offer that strengths-based coaching model to you. We do offer an opportunity for feedback the entire time. We want to make sure that you as the providers are in the driver's seat during this process. So as you're working with your consultant, please don't hesitate to share feedback regarding the network, regarding the process, and regarding your own experiences and what's working best for you. As we're working to build this network, we truly want it to be something that is beneficial for all Kansas providers.
Okay, here are our Child Care Health Consultant Network competencies. And these are the areas of expertise where our healthcare consultants assist child care providers in providing health, safety, and wellness in their programs, okay? And they're right here listed. There's 17, and they include consultation skills, quality health, safety, and wellness practices, policy development and implementation, health education, resource and referral, illness and infectious diseases, also children with special health care needs, medication administration, safety and injury prevention, emergency preparedness, response and recovery, infant and child social and emotional well-being, child abuse and neglect, nutrition and physical activity, oral health, environmental health, staff health and wellness, and maternal and child health. So these are all the 17 Child Care Health Consultant Network competencies. Next slide, please.
Thank you, Louisa. And as Louisa mentioned, those are the topics that we as health consultants are coming in and ready to work with you on. So the first 8 are our foundational pieces, where we really work to establish and make sure that as a provider, these foundational pieces are addressed. And then the remaining are ones that we work to ensure that quality is being infused and best practices are being offered in these areas as well. So the structure of health consultation is important to know as you are entertaining the idea of participating. We really look at this opportunity as one to get to know you as the provider and put you in the driver's seat of your goal setting. So we work together on an individualized intake process. This could be something that you get the opportunity to work with Louisa on. You may get the opportunity to work with a consultant on, but that is really your initial process where you will answer quite a few questions about your program and answer some questions about your needs. Maybe you have immediate questions and needs regarding a medication administration policy, and you really would like to tackle that right away. Let Louisa know during that intake process. We'll make a note of that, and we'll ensure that we can get you those resources in a timely manner. We then move on to our Child Care Health Network competency overview. So you will work alongside with your consultant to go through each competency and really take a look at what that means. We will provide examples as to how we can work on goals and what resources are available for each competency to help you identify where you would like to focus, or start your focus rather. We then ask all programs to complete a pre-survey. So this is something for us to work together to identify, what do you already know? What are you already implementing? What pieces are already familiar for you in your program? And then the consultant takes that survey and is able to use those results to implement and create that individualized consultation plan. Once that pre-survey is completed, the program then works to establish a goal. So we do that alongside the provider and the consultant, and they work together to identify a very specific goal within this competency wheelhouse. The goal execution is supported through consultant visits, and this can look like 3 visits, 4 visits, 5 visits. It really varies depending on that provider need and what the goal is. So again, it is not one size fits all. It is a very individualized approach that we are using to ensure that you as the provider are getting appropriate time and appropriate one-on-one coaching to ensure that you are feeling comfortable in that goal execution. Once those visits are completed and that goal has been executed, we then work together to share feedback. And like I said before, feedback is encouraged the entire way through. We also like to build it into the process as well at an intentional spot to give you, the provider, the opportunity to circle back, reflect, and provide feedback on your experience. We then look to a post-survey where you will take the survey and reflect on what you have learned and what tools and resources are now available to you that maybe you didn't have access to when you completed your pre-survey. So that post-survey will give us all of the information that we need to identify how the goal has been executed, where you're comfortable, and what level of competency you have moving forward on working with this goal in your program. So special projects. We are excited that as the Child Care Health Consultant Network, we get to offer a variety of special projects for providers as we are working to serve you in multiple modes and a range of ways and opportunities. As we know, one-on-one may not work for everyone's schedule all the time. We do still want to be available to providers who may not be actively involved in that goal setting process. So if you are in a region and you say, you know what, I'm not quite ready to engage in that goal setting process yet, But I would like to talk to a consultant, I would like to network, and I would like to learn more. We can offer networking and support meetings by region. Right now, we have 3 regions that are offering something along those lines, and they are piloting this to determine the need and really gather that feedback from programs. We again are offering opportunity to provide feedback all throughout the process. So during those networking supports meetings, you as a provider get the opportunity to share feedback and be an active participant in a community that discusses health, wellness, COVID-19 mitigation, and childcare provider supports. Very, very important. We also, I will let Jessica speak a little bit about the bilingual supports that we offer. She specifically offers some in her region and then reaches out to other regions as well.
Thank you, Sarah. It's pretty much the same as the networking and support meetings that the other regions also offer. Basically what it is, we focus on a topic. For example, this month being Child Abuse Month, we focus on a topic and just kind of discuss that topic, and we discuss resources out there that especially focuses on that topic, and within providers, they each give their opinion and how they promote that topic in their daycares. Every month is a different topic. It just depends on what the provider is requesting or what they want to talk about that month, or they give me opinions on what we should discuss further in future months. That way they pretty much are doing their networking and also identifying resources in their community.
Thank you, Jessica. So technical assistance, that is what we coin our coaching and consultation services as. And we have a variety of ways you can request that technical assistance. So as we stated before, it is available to all licensed childcare providers in Kansas. Providers can request consultation services by filling out an inquiry form at the website ks.childcareaware.org. You also may email cchc@ks.childcareaware.org or call toll-free 855-750-3343. The technical assistance is offered at flexible provider times. So we understand that you are with kiddos during the day, and we appreciate that. So we do not want to take you away from your important work, and we would like to support you during times that you're available. So we're able to offer flexible meeting times, whether that is a weekend, an evening, nap time specific, we can work with you. And again, delivery of TA will consider all local COVID-19 protocols. And when and if in-person delivery is possible, we will let you know. Otherwise, it will be virtual TA. So here again is our contact information. And if you are looking to send an email, it is helpful if you can include your provider name, program name, your phone number, and any additional contact information you would like to share with us. That will help us ensure that we can make contact with you. All right, we're going to open it up to Q&A, but before we do that, I would like an opportunity to share with you our website at Childcare Aware of Kansas so that I can show you where to go ahead and inquire about a consultation and find more information. So I am going to go ahead and share that website now. All right, so here is our Childcare Aware of Kansas webpage. And as a provider, you can scroll over here and you can see all of our offerings that we have right now available to providers. So if you're looking for more information on impact grants, this is the place to go right here. If you're looking for a training calendar, professional development, support services, additional helpful links, or the Child Care Health Consultant Network. You can scroll down here. And then you can go ahead, read a little more about the network. Stay tuned to this area as we will continue adding resources, information, and potentially additional webinars, videos, things like that as we work through them. So stay tuned here for more information. But if you would like to sign up for a consultation, you can click right here on the fill out intake form. And then you can fill out this form for a request and it will get to us. And then we can place you with a consultant to work through any goal setting, any questions, and get you started on your plan. So that is the website and the area to find additional resources. And we're going to go ahead and open it up a little bit to some Q&A now to answer some questions from providers. I know that we have a couple consultants that have been monitoring the chat. So Bridget, maybe if you see a couple questions that have popped up, you want to share those out, we can do that.
Okay, we have a question from Rich Minder. Wants to know how long will funding for this network be in place, and will this remain in place when the pandemic passes?
Great question, Rich. So we are working through 2021 right now, and anticipating and hoping additional support will follow through as we are working to ensure that this is a health network and it encompasses all health, safety, and wellness needs related to early childhood. So right now, a feature of that, unfortunately, is COVID-19. But once we get through that hump, we absolutely are looking forward to continuing to providing these services.
Question from Hannah McGahee. Do any of the health consultants have an example of a project or problem they worked through with a provider?
That is a great question. I'll open it up. I know I have a couple in mind, but if any of the consultants that are on the call have anything they want to share, feel free. I know that we have worked quite a bit in the realm of COVID-19. And so we have worked with providers on identifying appropriate isolation space for a sick child. And that has been something that as early childhood educators, we all know is a challenge because we need to be with the children and we need to have contact with the children. However, when we're working to ensure that we are not spreading an illness, it adds another layer. So we have been working with programs to identify what an appropriate isolation space is for early childhood, how to ensure that you are following those licensing standards through the state of Kansas, and ensure that you are making sure the other kiddos in the childcare space are safe, healthy, and limiting their exposure to the illness as well. We also have worked with programs on medication administration policies and practices. That is another piece that programs have reached out and said, hey, you know what, I need a little more information. I need to just tweak my process just a little bit on how I do medication administration. I have multiple staff members and we need to align the process. So as the consultant, they visited with the program, they talked with the program about where they're currently at, what needs they currently have, and then shared additional resources, whether it was a format, a template to do some tracking, whether it was some additional information and a training opportunity through some of our partners as to medication administration practices. We also work to ensure that providers had information to share with parents as well, so that that education opportunity doesn't just stop in the program, it continues on to the parents and the whole community. So we really have been working on a few of those pieces. Those are a couple examples of some of the outreach that we have done with programs.
I saw Nita's hand go up. I'm not sure if she still wanted to ask the question. No.
Okay.
Sarah, would you be able to speak to, or really any of your experts, speak to situations that were the provider had an issue with a lack of capital? So maybe they had some health and safety stuff that they had to address, but there was a fund issue to upgrade or to bring things where they needed to be?
Absolutely, Hannah, thank you. So we in 2020 did get the opportunity to connect providers to a funding opportunity through grants. In 2021, we are focused on our consultation services, but we are able to refer providers to funding opportunities we know about, we hear about, and we learn about. So we know that there is a lot of information coming out right now, and there is a lot of stuff to keep track of. So we as consultants are working to be experts in those areas so that you don't necessarily have to. You have a lot on your plate as a provider. So currently right now, we have providers reaching out to us asking questions about funding and how to ensure to get that capital to make sure that we're able to secure proper cleaning supplies or staffing to do the cleaning. Or maybe we need to make sure that a program has up-to-date thermometers, things like that. We really have worked with those programs to then identify what they need and then refer them. Right now, we're referring folks to the impact grants available through Child Care Aware of Kansas. And they can go through that process, complete the application. There's no consultation needed for those. And we really work as that connector to those pieces. So as providers have questions and they're working with a consultant, we will do everything possible to ensure that opportunities as they come along and as they're available are presented. And if you as a provider are in a dire situation and you need to reach out and let us know that. And we can do our best to connect you to the folks who can help.
We have a question from Rich again. He wants to know, how does this network coordinate with the infant toddler consultants?
Great question, Rich. So we are actually working through a referral process. So we had an opportunity to meet and discuss what that will look like. We're working on some of the ins and outs of that right now, but we are working to ensure that if a need is identified through a child care health consultant, we can talk to those infant toddler specialists to connect those programs and providers. We also, on the flip side, are available for those infant and toddler specialists so that if they have a question and they think, maybe this would be an appropriate piece for a health consultant to jump in on and support, we then will receive a referral and we can work with those programs based off of that referral. So we are really working to ensure that the services that are already in place and available throughout the state of Kansas remain that way and stay very, very, very much at the top of mind of all providers. And again, we want to be that connector piece. So we may work to do a referral. We may work to receive those referrals, just depending on those provider needs. And we will continue to do that and make sure that our services are talking to each other so that we can make sure to support and not duplicate.
Okay, Nita has her hand up. Do you have a question?
How do I?
Oh, we can hear you now. Well, you're freezing now.
Can you hear me?
Yes.
Are you recording this? Because I have missed quite a bit and I am not hearing a lot of it. So it's like in and out. I've been sending messages saying that you're cut in and out.
Yes. Sorry.
Yes.
Yeah.
We are recording this. This is Debbie, and this is all recorded, and it will be available on the Kansas Children's website under the webinar page. You can review previous webinars, so all of it will be there for you to refer to if you've missed some of it today.
So is all the questions and stuff going to be on there too? The questions and answers that everybody's asking?
Yes, the entire time that we're on live, it will be there for you to listen back to. So the presentation, the questions, all of that will be there.
Just so everyone knows as well, the team is
Okay.
working.
Thank you.
You're welcome. The team is working to collect questions as they come in, and we will be working on a Q&A document to post on the website so that you can reference back to that as well. So just stay tuned there, and that Q&A document will be available for some of these commonly asked questions, and we can go ahead and share that with you all once it's there. All right. Well, I think, are we good on questions, Bridget, for now?
For now, I don't see any more.
All right, wonderful. Well, I would just like, on behalf of Child Care Aware of Kansas, the Child Care Health Consultant Network, I would like to thank you all for this time and the opportunity to share with you about the work that we're doing. We're thrilled to be able to offer this to child care providers in the state of Kansas, and we look forward to hearing from you and working with you.
Thank you to Sarah and the entire team today for sharing this information. This type of personal and professional support for our early childhood providers during this pandemic is so greatly needed, and we just appreciate the work that you're doing to help the families and children and providers in Kansas. So great job today. We appreciate it. Okay, I'm going to move on to the last segment of our webinar today, just announcing some of the things that are coming up. The Early Childhood Recommendations Panel meeting is scheduled for the 16th of April, which it's always on the third Friday of every month in the morning from 9 to 11:30. You can register for that and view it on the Cabinet's website. Our next bi-weekly webinar will be 2 weeks from today, April 21st. And please always contact us and let us know if you're interested in any specific topics or have information that you feel would be meaningful to share in our webinars or our weekly emails. We have our Children's Cabinet meeting coming up this Friday, April 9th, from 9 to noon. And then that afternoon from 1 to 3:30, we have our stakeholder group meeting, and you are welcome to listen in on the cabinet meeting and then also join us for the stakeholder group meeting. And please share any feedback that you might have for us, questions, concerns, suggestions on our cabinet website, kschildrenscabinet.org. So we thank you for sharing your noon hour with us today, and we thank our presenters again for the information that they shared. And we hope that you have a good rest of your day, and I'm going to leave you with a thought. It takes a big heart to help shape growing minds. And I know that all of us working in the early childhood field in one way or another are helping to shape growing minds. And so thank you for having big hearts and for the work that you do and the services that you provide. And again, thank you for joining us today, and we'll see you in 2 weeks. Take care, everybody.